Once a patient has been initiated on a medicine and you've titrated them, you've checked at initial level, you've established that the dose is appropriate, the level is appropriate, and now you're going to go forward and follow them in terms of their management. One of the biggest concerns is consistent adherence or compliance with the medicine. It's very hard to remember to take medicine every day, sometimes multiple times a day. And so this is a conversation I frequently have with patients in terms of what do you do to make sure you're taking your medicine and how do you know you've taken it? So I'm a big advocate for pill boxes where you put out the week's medicine, and if you get up on Tuesday morning and you look there and there's Monday night's medicine, you know you've missed it, and then you can catch up and maybe avoid the breakthrough seizure the next day or the following day because of the medication mistake. In addition, it's important to talk to your patient about what do I do if I miss a dose and have a kind of a plan as to how they may or may not catch up. Some of our drugs you can double dose and do fine, like levetiracetam. Other drugs like lamotrigine, if you double dose that, you may have significant side effects in terms of CNS toxicity. One of the important things that happens in the clinic is when you're getting a new patient that's transitioning from pediatric neurology to adult neurology. Practitioners in pediatric neurology many times have a different focus and many times also have more support in terms of social workers or nurses that are kind of more nurturing and helpful, while the adult neurologist tends to be alone in the clinic without the supportive services as much. And so you need to be attentive to the new patient to make sure that they're aware of community resources and other things that can help them kind of re-equilibrate in the adult world. Particularly in the brain injured or intellectually disabled population, you really need to work with them to gain access to community services, day programs or whatever, so they maintain their socialization and their quality of life. At about the same time that patients are transitioning from pediatric neurologist to adult neurologist, the dynamic between caregivers, parents, and the children frequently change, and there has to be a transition in terms of the independence of the patient and responsibility for taking medicine. And that can many times be a challenge, both from getting the parent to relax a little bit and get out of their kid's face, and the child taking responsibility and being reliable and consistently taking the medicine. I've talked about using a pill box, and I talk about it with them because then it gives you the advantage of the parent can go behind them, check the pill box, make sure that the medicine's been taken, while at the same time not having to be in front of their child and kind of questioning them and pushing them and creating the antagonism that can go along with that relationship in trying to maintain adequate health care as that young adult or burgeoning young adult becomes more independent. So when patients are transitioning from the pediatric to adult clinic, you need to make sure the family have avenues of communication. I personally, with the electronic medical record now, they have better email access. I've always used email contact with the patients because I think it's very important that they have the ability to communicate with their physician, and allows you to get back to them kind of on your own time, but in a timely fashion, possibly to keep them from going to the ER or addressing side effects rather than having ongoing issues. And as that child transitions into adulthood, you then also have to push the patient, that 18-year-old, 19-year-old, that they need to communicate with their physician. They need to take responsibility for taking their medicine, and they need to take responsibility for communicating with their physician and other caregivers as to what's transpiring so that we can troubleshoot and help out and kind of maintain their seizure control and eliminate any setbacks in terms of side effects.